Why does COPD cause shortness of breath, dyspnea? Imagine trying to breathe through a straw that keeps narrowing. That's similar to what happens in your lungs when you have chronic obstructive pulmonary disease. This condition is a long-term disease that damages your lungs and makes breathing harder. But why exactly does it cause that feeling of not getting enough air? Let's break it down in simple terms. Chronic obstructive pulmonary disease mainly involves two problems. One is chronic inflammation and narrowing of the airways, called the bronchi. This swelling and excess mucus production block the airflow, making it tough to breathe in and out smoothly. The other problem is damage to tiny air sacs in the lungs called alveoli. These alveoli are where oxygen enters your blood and carbon dioxide leaves your body. When they get damaged, they lose their shape and elasticity, so they don't work as well as they should. Because of these changes, your lungs can trap air inside even after you breathe out. This is called lung hyperinflation. It means your lungs stay partially full of air, which leaves less room for fresh air when you breathe in. This makes each breath feel more effortful. When you move around or exercise, your breathing speeds up, but because your lungs are already full of trapped air, it becomes even harder to get enough oxygen and get rid of carbon dioxide. This causes that shortness of breath you feel during activity. Another reason is mismatch in ventilation and blood flow in the lungs. Some parts of your lungs may get plenty of oxygen but not enough blood, or vice versa. This reduces how efficiently oxygen gets into your blood and how well carbon dioxide is removed. As a result, your blood oxygen levels drop and carbon dioxide builds up. Your brain senses this and signals your body to breathe faster, which you notice as feeling breathless. Muscle weakness and reduced physical activity also play a part. When your muscles, including your diaphragm, work harder to breathe, they get tired quickly. This fatigue makes breathing even more difficult and adds to the feeling of being short of breath. So, in simple words, COPD causes shortness of breath because the damage to your lungs and airways makes it hard for air to flow freely. The trapped air, damaged alveoli, and inefficient gas exchange all mean your body has to work harder to get the oxygen it needs. That extra effort makes you feel breathless, especially when you're active. Managing COPD involves treatments that help open the airways, reduce inflammation, and support lung function, making it easier to breathe and live more comfortably.